In this quick tutorial, you'll learn to efficiently treat plantar fasciitis. The primary cause of this condition is excessive tension on the attachment of the plantar fascia into the anterior calcaneus. The foot is composed of many joints, but becomes a stiff spring when the muscles acting on it become taut. The plantar fascia is an important part of this spring mechanism because it is essentially a tension cable between the heel and toes. Normal weight bearing and walking can create increased tension on the plantar fascia. The increased tension pulls on each end of the plantar fascia. The plantar fascia attaches distally into the fascia that crosses the metatarsal heads and extends into the toes. Proximally, its attachment is on the calcaneus. Because the attachment site on the calcaneus is so much smaller than the attachment region across the metatarsal heads, there is more force per square millimeter applied to the attachment site at the calcaneus. This concentrated force leads to the development of plantar fasciitis. The primary goal of plantar fasciitis treatment is to reduce tensile stress at the calcaneus attachment site of the plantar fascia. Reducing tensile stress gives the irritation site a chance to heal. When addressing plantar fasciitis, it is better to treat the muscles of the entire lower extremity because biomechanical compensations as a result of the foot pain could have effects on the entire extremity. If you have time, start on the thigh and work down. The plantar fascia has fascial connections with the posterior calf muscles. Start with broad muscle stripping and follow up with the small contact surface to decrease muscle tone in the posterior muscles. Deep stripping techniques encourage tissue elongation and decrease hypertonicity in muscles, which helps to decrease tension in the kinetic chain of tightness in plantar fasciitis. If your client has trigger points, inactivate them. Work on the lower leg and the Achilles tendon. This really helps to reduce muscle tone. Deep stripping techniques help with tissue elongation in the plantar fascia and the flexor muscles on the plantar surface of the foot. For better results, apply heat to the treated area for 5 to 7 minutes and work more specific with the myofascial tool. Work toward the calcaneus to reduce tensile stress on the plantar fascia, and it's less painful for the client. Fibroblast activity can be increased in the plantar fascia with friction techniques. Apply friction near the calcaneal attachment of the plantar fascia. You can finish the treatment with stretching. We hope that this video will help you in your practice, reduce everyday stress on your hands, and save you from work-related injuries. We would love to hear your suggestions in the comments, and subscribe to our channel. Thanks for watching.